Hello everyone, my name is Priyanka Mistry and this is the HICOR project for project management. HICOR is a part of Fred Hutchinson Cancer Research Center who created HICOR IQ. HICOR IQ is a platform, a software platform that takes the data from the cancer registry, processes the data to create matrix, and currently presents the data to healthcare and insurance providers. However, HICOR IQ is missing an important data source, the patient. It is a desired trait to collect patient reported outcomes and allow patients to use the information from the platform to improve healthcare decision making. Our project scope was to research what patients want with respect to a platform like HICOR IQ. What are the patients interested in? How do they prefer to submit their patient reported outcome information? How can patients be engaged to use the tool consistently? What methods should be used to display the data? Our task was to gather data from academic resources, patient interviews, and market sources to answer these questions. As per the scope of the project, we performed patient interviews with questions created by our team and approved by the client. For academic research, we reviewed journals and papers related to the subject matter and used the material to supplement the findings from the patient interviews. For market research, we searched for another similar platforms on the market to review the performance and the methods used. We initially generated a list of questions that would become the focus of our data collection efforts. These questions would be the questions asked in the interviews and also the focus for academic research and market research. Please pause the video if you would like to read the questions themselves. Next, after performing 6 patient interviews, the questions were summed up into key findings. The 5 most notable findings are listed here. Firstly, we found that all of the interviewed patient advocates use mobile phones and Facebook, while 83% of them used tablets and PCs. Secondly, when using technology, all of our interviewees would browse message boards, perform healthcare research, check email, and access news. When asking about the criteria they used to choose between treatment options, patient judged treatment cost as the highest, followed by the advice of a medical professional. After that, the reputation of the treatment provider and the community's advice. Patients themselves were most interested in information about their peers' journeys, treatment results, treatment costs, and ratings. For academic research, we found that, similarly to patient interviews, patients favored tablet computers and other handheld electronic devices such as mobile devices. Many patients use the internet as a source of health information when seeking explanations of their diagnosis, feeling dissatisfied with the information with their physician, or looking for additional information. Message boards and mailing lists were identified as information and peer support sources used by patients. Further, market research was performed on Cancer Care Ontario, who launched a patient reported outcomes and symptom management system. Cancer Care Ontario partnered with information management and technology partners to become successful in gathering information. An example of a partner would be clinics or existing databases of patient information. The incoming information is primarily grouped by type of cancer, followed by skills of personal care and medical resources. When patients provide their patient reported outcomes, they would receive incentive back, giving access to additional features of the Cancer Care Ontario application, such as discussion areas and forums. Additionally, Cancer Care Ontario puts efforts into creating good relationships with patients, educating families, friends, and patients on the value of the patient reported outcomes. Cancer Care Ontario also has a pipeline implemented to adopt, review, and roll out new patient reported outcomes to keep the system changing and adapting across time. In general, the following recommendations were made from the data analysis. Firstly, gathering data should be done When it's convenient for patients due to health variables, it is best to allow patients to submit data by their own schedule. Additionally, to build trust in the data, inform patients where the information presented is coming from to ensure that the data is trustworthy. The data should be audited and possibly link data to online sources. The questions asked to patients for collecting patient reported outcomes should be short, simple, and clear to the patients, and the results should be able to provide information on general user journey and treatment results. In order to build engagement, involving and educating the patient's friends and families will increase understanding of the value of patient reported outcomes. All the data analysis is used to generate recommendations for features to implement. With respect to the methods of collecting data, we suggest developing a web application accessible from laptop, desktop, and mobile platforms with the option to provide tablets to clinic to allow patients to submit PROs at the clinic in case the patient does not have access to technology at home. Another option is to have all the data collected by medical professionals and submitted to HICOR IQ after review by the patient themselves. This method may improve data quality but would increase the cost on training and the clinic staff. Now, with respect to patient engagement, we found that patients enjoy spending time in forums, reading and communicating with others, so implementation of discussion boards would be useful as this builds a community. It would allow patients to discuss matters of interest like PROs regarding adoption of new treatments, outcomes, user journey stores, and ratings or reviews. Another suggestion is to use the idea of gamification to increase involvement. Patients could be rewarded for submitting patient reported outcomes and participating in community discussions, earning rewards, points, giveaway options, or levels. To lower the potential of patients completing low numbers of patient reported outcomes questions, single short questions should be created for the user to answer easily when the user logs in. In line with the data analysis, it is important for the patient to be able to share findings, educate and engage their families, friends, and peers. Additionally, usable features could be added to make the application provide more value to the patient, such as issuing alerts for appointment reminders, receiving health recommendations from professionals, scheduling appointments, and requesting the prescription refills. Now, for presenting data, we suggest presenting treatment results and side effects, user journey stories, professional advice, and possibly average cost of treatments. Additionally, the interface should be customizable for the patient so that patients can choose what information to display based on what they feel is important. Thank you everyone for your patience. Please feel free to ask any questions.